Hello once again, it's Mama Bear. I'm back again, and today's topic, as you can see, is danger signs in pregnancy. I told you in the last video I'm going to talk about the danger signs while we were talking about the common problems. So today we're going to talk about the danger signs. All right, I'm going to first tell you labor signs real quickly. Labor signs are contractions that last you know, more than 5 minutes, or 5 minutes interval, strong, you know. Number two is water break or mucus plug remover. And the third one is bloodshot. And I'm starting with the sign because it's a good sign when you are due, when you are actually due for your EDD, estimated due date is okay. But those three signs can be danger signs if you are not due. So say you're not due, you're in your 20 or your 20 week 20, or you are say in second trimester. Let me put it like that. And you're seeing bloodshot, mucus plug, oh Lord, you need to start coming to the hospital. So, and that's why I'm starting with that, so you guys know what I'm trying to say. Okay, another one I want to say is swelling. Say your feet swollen. See, sometimes feet can be swollen with pregnancy, but be sure that your blood pressure is not on the high side. Okay, so when we have swollen feet and all parameters are fine, because swollen feet come sometimes with pregnancy. When we don't have other signs attached to it, we tend to be calm about it, and we tell you to raise your feet and stay away from salt intake, reduce the salt intake. But in this case, I'm talking about a swollen leg that is significant. Okay, there can be two things going on. It could be PIH, which is pregnancy induced hypertension. That means you don't have high blood pressure before. It's just when you got pregnant. And another thing that can bring all of that is called preeclampsia or eclampsia. This is when a pregnant woman starts to have seizure, which is not good. But before the seizure, there's things that are happening. We call it preeclampsia. So that is pre the seizure. That is before the seizure. Those are the signs we look for when your hands are swollen and they tell you have protein in your urine, and you are having hyperreflexia, you jump at everything, you stutter at everything. All the signs are all pre-seizure signs. So they are danger signs. Okay, so moon phase, you wake up and your finger looks like sausage, like sausages, you can only keep them apart. You can't bring them together because they're so, chunky looking. Though that is a danger sign. You need to start going to the hospital. Don't even question it, because you didn't sleep like that and you woke up with your fingers all swollen. Face can look like a moon, like that's why we call it the moon phase. So there can be other diseases on the lane. You need to quickly run to the hospital. Repeated fainting. You keep fainting. We know fainting, dizziness comes with pregnancy. Repeatedly fainting, you get up from one session or one episode, and the next 5 to 3 hours you seize, you faint again. And sometimes it could be convulsion. If you're having these signs, you need to go to the hospital immediately. Vaginal bleeding is another danger sign. Okay, I told you there can be spots. There are spots. We call it spotting. When you're spotting, that is okay, like the size of a coin. I think I mentioned in my last video. So that is okay. But when you're seeing it like almost taking the whole panty liner or the bottom of your underwear, at that point, please, I need you to start going to the hospital. Okay, leaking amniotic fluid. Some of you don't even know what it is, but guess what? You sit down and you wet, where you're sitting is real soaky wet, or just a little wet, or your underwear is wet, or you're in the bathroom and you're sipping water, or you're just standing sipping water, and you don't know, and you know for sure you're not urinating, which I know. If it's not urine, then it is amniotic fluid. It smells like a weak bleach solution. All of us know what bleach is. So imagine you're smelling very weak, not really strong, like weak bleach solution. So when you put your hand, you smell it, and it doesn't smell like urine, then it's amniotic fluid. That is the fluid that inside with the baby that keeps the baby, alive and well. Keep the baby nice and moist, lubricated. So that means you're losing that water. So it calls for hospital. High blood pressure, sometimes is attached to headache. You're just having this headache that will not go away, even with taking medications. You've slept, you've drank water, and this is just severe. You need to go to the hospital. Excessive tiredness, excessive thirst, blurred vision. You just see that all of a sudden you can only see real blurry, and that could be episoda. Like it can just happen like a flash, and it comes back again. You need to go. It's a warning sign. You need to go to the hospital. Sometimes the blur is just there, and sometimes it happens like a flash. You still need to go to the hospital. That part, we are kind of afraid of diabetes. That is gestational diabetes. That's diabetes in pregnancy. That means you are not a diabetic patient. It's because of the pregnancy. Excessive tiredness, that's another thing. We can be waving or swerving towards diabetes. So you need to watch out for that. And my big one that I save for this time is depression and anxiety. A pregnant woman should not be depressed. I'm not kidding. A pregnant woman is supposed to be happy all the time. Yes, sometimes they have mood swing. Remember, I mentioned mood swing in my last video. Mood swing is normal, is a common problem. It's not, it's part of pregnancy. I told you, they tell you some joke today, you laugh, and the next time they say it, you just ease, and it's not funny. Get it? So, not coming up, just as the name is, mood swing. You're swinging, you swing out. That is what we want. That is what we see as, okay, it's part of pregnancy. But when a woman is unable to come out from her mood swing, that is depression. That's when she doesn't look, it doesn't seem as if she's going to, she doesn't want to bathe, you don't want to do anything, you're just there, you're feeling worthlessness, hopelessness, incompetence, you're feeling like nobody likes you, you're feeling alone, you're feeling like, oh, he hates you. You just feel for some reason. A lot of things can trigger it. Some is blame on hormonal imbalance. You know how our hormones are not balanced in pregnancy. But anyways, always, when you catch yourself not doing what you're supposed to do and you're feeling sad about things, you need to go to the hospital. Okay, they have counselings all around. I counsel, but if you are not far away, I can counsel you on Zoom if you want me to, but I do counsel. But if you're closer to someone that can talk to you, please and please, depression is not so good, because a depressed pregnant woman is open and, of course, prone to have a postpartum blues. And that's in our next topic. We're going to talk about postpartum blues. All right. I don't want to bore you or anything, but I just want to give you those dangers. If there's anyone I didn't mention and you want to find out to me, you can talk to me, DM me. Okay? And I wish you all safe delivery. Love from Mama Bear. Bye.